All right, I want to ask another question because we are seeing so many more young women present with breast cancer, and they have other issues. Number one being fertility. I mean, if you get it in your 50s and 60s, that's not an issue. But these young women, when it comes to the fertility issues that are related to chemotherapy and options to be able to get pregnant afterwards, what should they be doing? Where should they be sent right to a fertility specialist? And is it's even safe to get pregnant afterwards?
Yeah, great questions. So I guess the most important thing is that a young person, a young woman who's diagnosed with breast cancer, before she gets chemotherapy, should be informed that that could be an issue. And as cancer centers are rated or assessed for quality, you know, having some type of counseling documented in the chart that this woman understands that there is a chance that her breast cancer treatment might result in infertility, you know, is something that people look at. Having said that, we're talking mostly about the 30-year-olds. The most 40-year-olds are completely okay with this, but it's the occasional woman that we see in her 20s and 30s who has not yet had any children that we want to make sure they understand this. And yes, there are ways to harvest eggs and to try to make a contingency plan for infertility that might happen from chemotherapy. But the reality is that probably in that age group, about 50% of them will resume a cycle and can go on to have children later in life. So it isn't a 100% slam dunk that they will be infertile. The younger you are, the higher the probability that you're going to resume your menses and be able to get pregnant. And if you only need 4 cycles of chemotherapy as opposed to 8, higher probability that you will, you know, resume your cycle and be able to get pregnant. Then the women that need to go on tamoxifen, that's another issue, because tamoxifen just is not a good thing for a developing fetus to have to endure. And so women who want to get pregnant, we don't use tamoxifen, or they come off tamoxifen in order to get pregnant. I think, you know, the data does not really suggest that getting pregnant after breast cancer will make your breast cancer go cuckoo bonkers. But I try to have people at least have 2 years to restore their health after such treatment so that they're healthy and able to carry this pregnancy.
And we just heard from a young woman who was diagnosed with breast cancer, young age, I don't recall, maybe 31, had just gotten married, no kids, and she had her eggs extracted and they made their embryos. Mm-hmm. Because she had to be on tamoxifen for a number of years, they used a surrogate.
Right.
And it's their baby, and she used a surrogate, and she has a wonderful little boy right now who's
absolutely
almost a year old, and she's as happy as can be. But I mean, you know, when you get the shock of you have cancer, I mean, these are so many other things that you have to think about when you're younger that a 55, 65-year-old woman doesn't have to go through that thought process.
Right. Absolutely. Absolutely. But if you are young and are diagnosed with breast cancer, or really any cancer that requires some type of chemotherapy, make sure that you ask your oncologist these questions and confront it and understand it.